Now, one of the significant changes over the last several years has been the rise of indicators. It's like the rise of the machines. Those of you in current culture, anyway. I can see most of you aren't. There's no response to that at all. Ask your neighbor about it, and ask a kid about it, and you'll get it. There are lots. There's the Healthy People, of course, now entering its fourth decade. The community health status indicators, the county health rankings. And now I guess it's about, I don't know, 7 or 8 years ago, David Walker, who was the Controller General of GSA, said, you know, every country, or many countries anyway, have national indicators. The U.S. has no national set of indicators. And he said, I think this would be a very good thing for the U.S. to have. So there was a series of meetings that gave rise to something called the State of the USA. And then it turns out that a not highly recognized or component of the health reform bill took that challenge up and said we should have a set of national indicators, okay, and gave provisions for developing that set. And I think it's very likely that the State of the USA, which is on the web, by the way, if you just Google it, will morph into a set of national indicators with help from the National Academy of Sciences, and we will have a much more prominent set of indicators than we've had in the past. So you're all familiar, of course, with Healthy People. This is the framework. I don't know if you can read all this in the back, but we'll do a test later on it. But it's got these basic categories: general health status, quality of life and well-being, which was not emphasized in the former versions, determinants of health, which was really not emphasized in the former incarnations of this, disparities, and altogether there's 42 topic areas with 600 objectives. But if you really count, as my colleagues in NCHS who are responsible for collecting a good deal of this data and collating the rest of it, there's probably well over 1,000 indicators in this set. By the way, Healthy People, when 2020 was being created, there was a cry from many areas, particularly in the department. I don't think it was true around the country, that this is too many indicators. Boil it down to 25 and you really got it. You know, this is crazy. But there's such demand for this, and I was not in favor of that. I actually think a rich framework is very good, and then Kentucky can draw from that framework, okay? And we've got a solid, consistent, very strong database that can be used to meet local needs. However, the Institute of Medicine, at the request of the department, said, well, we think you need a leading set of indicators. Okay? So there's 12 categories, which are further broken out in a recent report into 24 measures, which can then be broken down some more into something like 60 measures. But these are the categories that the IOM felt were the leading health indicators. There's the county health rankings, which were just released. By the way, I think the website is terrific. I think this is really a terrific job. This is based on what Wisconsin, as you probably all know, based on what Wisconsin was doing, okay, expanded through, I'm happy to say, our help at NCHS, CDC's help, and others, and through the support of the Robert Wood Johnson Foundation to become this national effort. I think this is really, really terrific. It relates very strongly to the community health status indicators, which once upon a time were at NCHS and then CDC, and now are based at HRSA with NLM. And these two sites are very complementary. But for us, coupled with Healthy People, this is a tremendous demand for information. So it helps us create our agenda, but also the agenda for the rest of the federal data establishment. Health reform and the requirement to track this in process and in impact is also a tremendous challenge at this time. But I think it's one that, based on our work with the Assistant Secretary of Planning and Evaluation, I think it's one that we can meet. And we've been working on doing this in the department, and are working on creating a dashboard that would be open to everyone, so that we can track process on this.